Hello friends, today we are learning about a new chapter, pulp sensibility test. We have two terms, sensibility and vitality. Now we can see the difference between sensibility and vitality. Vitality is the capability to live, grow and develop. Development of the pulp. Pulp is capable of living, grow or development is possible after the damage. Sensibility Sensibility is the ability to respond to a stimulus. सेंसिबिलिटी एक एबिलिटी है पल्प की या पल्प उसमें कैपेबल होता है किसी भी स्टिमुलस के लिए रिस्पॉन्स करने के लिए, चाहे वो हॉट हो कोल्ड हो। इसमें हमेशा सेंसिबिलिटी के तीन टेस्ट होते हैं, हीट टेस्ट, कोल्ड टेस्ट एंड इलेक्ट्रिक पल्प टेस्ट। In the dentistry, pulp vitality means that there is an active blood supply to the pulp. डेंटिस्ट्री में पल्प वाइटिलिटी का मतलब होता है कि पल्प में अभी भी कहीं एक्टिव ब्लड सप्लाई शुरू है। The common tests we use in the clinical practices such as heat test, cold test or electric test. It do not measure vitality, they measure the response of pulp to the mentioned stimuli. We apply the heat to the tooth surface. In cold test, we apply any cold stimulus to the tooth surface. And in electric pulp test, we have a machine which are capable to taste the pulp vitality. We also have some special tests. We have some specific tests like laser Doppler, flowmetry, and pulse oximetry to measure the pulse blood supply. But these tests have not been developed to the point where they are useful on a routine clinical basis. So, what is the laser Doppler flowmetry? Laser Doppler flowmetry is an optical measuring method that enables the number and velocity of particles conveyed by a fluid flow to be measured. They are used to locate and diagnose a tooth that has necrotic pulp or is pulpless and infected when suggested so by history. ये टेस्ट हमें लोकेट और डायग्नोस करने के लिए यूज में आते हैं कि जो भी कोई टूथ का पल्प नेक्रोटिक हो या पल्प प्रेजेंट ही ना हो, पल्प एब्सेंट हो, पल्प इन्फेक्टेड हो। अगर पेशेंट की हिस्ट्री से ऐसा पता चलता है तो the findings from the pulp test should be correlated when the case history and clinical findings to arrive at a proper diagnosis. So now we can see the heat test, cold test and electric pulp test. So first was heat test. In the pulp we have two types of sensory fibers. One is myelinated and other is unmyelinated. Myelinated fibers are A fibers and unmyelinated fibers are C fibers. A fibers are divided into A beta fibers and A delta fibers, where A delta fibers are mediate acute sharp pain and C fibers perform dull burning and poorly located pain. In pulp test, we can use any type of heat conduction instrument or thing which can tested on the tooth surface, then it gives the response by patient and we can note the response of the patient and observe it is pulpitis or irreversible pulpitis or reversible pulpitis. So heat test is performed by using various materials that deliver different degrees of temperature. Now we can see the procedure of heat test. The area to be tested is isolated and drying by air rotor air and isolate by cotton. A suitable lubricant is then applied. Vaseline is applied on the tooth surface. Then heat is applied and heat is directed to the exposed tooth surface and the patient's response is noted. An electric heat carrying instrument is preferable as the temperature can be precisely controlled, or a hot gatta pulsar stick can be used, and also the hot ball burnisher is also used to carry the heat. Now we can see the where heat can be applied on the tooth surface. So the heat is applied to the occlusobuccal third of the crown, as you can see in this image. If there is no response, the stimulus is applied closer to the central portion of the crown or the cervical margin, as you can see in this image. The stimulus should be removed as soon as response occurs, and the heat test should be applied for no longer than 5 seconds. Excessive heat should not applied or excessive heat should be avoided, and prolonged exposure of the tooth to the heat should be avoided. It should be done on controlled tooth before doing it on the tooth of interest. When heat is applied to the tooth surface, vasodilation occurs, causing an increase in intrapulpal pressure. It should be done on firstly done on controlled tooth, means done on normal tooth, then it will be done on the tooth of interest, means patient complain of pain on which tooth. When heat is applied to the tooth surface, vasodilation occurs and causing an increase in intrapulpal pressure. When heat applied to the tooth, vasodilation occurs and intrapulpal pressure increases. So what is the intrapulpal pressure and what is the role of the intrapulpal pressure? Intrapulpal pressure is the pressure inside the pulp which can stimulate the pain sensation on the tooth. The role of the intrapulpal pressure is very important in the dentistry and in the tooth. Intrapulpal pressure can be increased by heat or the position of the patient when position sit or lying or sleeping. The intrapulpal pressure will be increased, and when the heat is applied, the intrapulpal pressure is also increased. Clinically, when the intrapulpal pressure will increase, the LA will not work because heat increased and LA not work. When inflammation is present, we don't give any LA, and LA not work because of the heat increased by the body. Inflammatory process are started and the pressure of the blood is increased. So the particular area of where the inflammation are present, there will be increased heat, and increased heat can also increase the intrapulpal pressure, so LA will not work on that particular area. When we apply heat, intrapulpal pressure will increase, and the intrapulpal pressure will activate the neural activation, and neural activation causing a response on the tooth. Now we can see how we will be differentiate the healthy pulp, irreversible pulpitis or reversible pulpitis by the heat test. If the response of the tooth The response of the tooth of interest is equal to response of the controlled tooth. It indicates a healthy pulp. If there is painful response that is significantly different from the that of the controlled tooth, if the pain lingers after the removal of the stimulus, then it is indicative of irreversible pulpitis. जब पेनफुल रिस्पॉन्स आफ्टर स्टिमुलस अप्लाइंग आएगा तो ये आपको डिफ्रेंशिएट करने में हेल्प करेगा कि ये इरिवर्सिबल पल्पाइटिस है और पेन लिंगर कर रहा है या लिंगर मीन्स लॉन्ग टर्म पेन जो स्प्रेड हो रहा है एक जगह से लेकर दूसरी जगह तक, तो उसे लिंगरिंग बोलेंगे. इट ऑल्सो कॉल्ड एलोडाइनिया. तो और वो स्टिमुलस रिमूव करने के बाद भी हो रहा है तो उसको इरिवर्सिबल पल्पाइटिस बोलेंगे. If there is no response after applying the stimulus or heat, it indicates that the pulp may be non-vital or pulp is dead. However, the heat test is not very reliable and should always be compared with clinical and radiographic findings. Heat testing is recommended when the patient's chief complaint is pain in contact with any hot liquid or food.